We were able to get Barry back in the ER. He started moving. The cath lab had already been activated because with the paramedics, they let the ER know ahead of time that the patient's coming in. So we had everything ready to go. And once we got heart rate back and a blood pressure, we brought him straight to the cath lab.
What is it can we do? We've done CPR, we've saved the patient in terms of restoring their rhythm, but they're not out of the woods yet, and that's where our team of physicians, Dr. Nagy and the cardiologist, put their heads together and said, this is what we need to do with this patient.
At that point in time, once he made it to the cath lab, we found that he didn't have any new blockages, that most likely what had occurred is that he had a bad heart rhythm, ventricular fibrillation. But at that point in time, we knew his heart wasn't pumping well. And by itself, it was not going to be able to support a blood pressure and supply blood flow to his organs. So the Impella device was a device that we place in there to basically provide blood flow to the rest of the body when the heart isn't strong enough to do it, to give the heart time to recover its function on its own. And we made that decision with him. So we were able to provide adequate blood pressure to his brain, to his other organs. And in a couple days, we were able to remove that device as his heart got stronger, and his heart was able to provide the blood pressure and blood flow that he needed. And without that device, we wouldn't have been able to do that. We wouldn't be sitting here talking about this success story that we are now.
It really almost seems like it happened to somebody else, because I remember so little of it when it actually happened that, I listened to the stories, and every day I learned something new about what happened. So it's really hard to believe it happened to me. Runs in the family. My father's had some bypass surgery, so it just comes with my family. I was a runner for years, like the Parker half marathon. I did the first 13 of those before I had a heart attack. And actually, when I had my heart attack, I was playing basketball at the YMCA. First time I had it, I was, in good shape, 41, and, I ignored the pain for a while because there's no way I could be having a heart attack. So you can't just assume because you're young, maybe you're healthy, you're indestructible, that if you think you've got it, you've got to go have it checked out. It's better to them to tell you you don't have it than to ignore it. Because, and then you can have some heart damage if you ignore it or something worse. Since then, I've tried to run off and on, but then I've had more blockages, I've had stents put in, and this has been the latest episode to happen to me. And there's a lot of people in West Virginia that have heart disease, and being a pharmacist, I'm able to share a lot of my experiences with them and help some of them accept going through it, telling them the things I can do, and that they can still lead a full life and do a lot of things, even though they've been diagnosed with heart disease.
By me working here, I know what potential we have. I know what services are available. I know what this facility is capable of. I would have not wanted to take a helicopter ride or an ambulance ride out of here. The people in your community that you work with, the people that you see at the grocery store, the people that you might meet at church or anywhere socially, chances are somebody's working here, and they take great pride in trying to take the best care of their patients. And if I would go somewhere else, they don't know me, and I feel like that because I am part of this community, I was going to get the best care that everybody that worked here could give my husband.
Unfortunately, this isn't my first incident, so then we have a lot of questions in between a lot of times, and it's really easy to find the answers to it. Because they know us, they know our history, and like she said, if you go someplace else, they're not going to know your history or anything about you.
Being a nurse and in the job that I have, I can see all the things that can go wrong. The lasting effects of somebody that has heart issues or has been resuscitated, and you can get kidney damage, you can get liver damage, you can get lung damage, you can get brain damage, you can have heart, your heart doesn't recover as well as it should. All these things happen, and it's truly amazing that everything came together And the technology was available to let us have the very best outcome that we could have ever hoped for.
I don't remember any of them, obviously, so I wasn't conscious, so it was nice to be able to actually see the people that helped me in the room, bring back some memories when I finally did wake up. So, but I was grateful especially to see the nurses that took care of me the first night, because I didn't even know who they were. I'm still learning a lot about the whole event. You know, there's parts every day I learn a little bit more about it, and even though I'd had things happen to me in the past, this is completely different. I mean, this was like just a fine line between you making it and you not making it, and sometimes you just can't even think about it because it's just hard to think about how close it is. But and then to hear all the people that came together to do it, you know, it's very gratifying. It makes me feel good.
And because of the experience that our team has of 20 plus years of doing cardiac catheterization, 10 plus years of angioplasty, stents, and an open heart, all that experience with an experienced team makes a difference when a sick person hits the door, because we've been doing this. It's not new. Some of the technology's new, but the thought process, the care process, and how our team reacts to emergencies is what makes us award-winning. It's the people that make it up, that make things happen. The certificate on the billboard's nice, but what matters is the people that we have here and what they're able to do to help our patients.
If it can be done here and done well, the focus has always been on what is best for the patient. It has nothing to do with an award, it has nothing to do with an ego, it has nothing to do with money or reimbursement. Our physicians, our cardiologists, our surgeons have always been what is best for this patient. They'll be the first ones, if they can't take care of a patient, a cardiac patient, the way that they deem is in that patient's best interest. They have a network of referrals, not only at the Heart and Vascular Institute, but elsewhere, and they'll make the appropriate referral. But the thing that Dr. Nagy, I think, is saying is, for me, is that most of the time we can take care of all of the needs, but when we can't, then we're going to know it and we're going to steer the patient in the right direction.
There's lots of care. I mean, there's just so many things that Kimberly-Clark has available that everybody should be very proud of, that we absolutely have here the best available tools and people that are needed. So if a body does respond to the treatment, it's because they got the best treatment and the body responded to it.
I mean, I've seen people with heart problems have an event like this. I have not seen someone that collapsed at home, had such prolonged CPR, come in, get them back, do everything that we do, and have them walk out of the hospital. Amazing. I mean, there's not words for what happened here, because his complete and total recovery is nothing short of miraculous.
Coming up next, a local man goes to the gym and ends up with a workout of his life.